The 4 symptoms that you're going to use a urogynecologist for are going to be pelvic organ prolapse, urinary incontinence, fecal incontinence, and sexual dysfunction. There are some urogynecologists who also treat pelvic pain. When you talk about pelvic organ prolapse, the symptoms are usually pelvic pressure and usually some vaginal laxity, so you'll see the vagina coming down, and then it coincides with other symptoms such as fecal symptoms or urinary symptoms. So that's your pelvic organ prolapse. For urinary incontinence, there are different types of urine incontinence. Anytime the urine is coming out when you don't want it to come out, you are leaking. It is incontinence. It gets worse closer to menopause. Please get it seen so that it's not affecting your quality of life and your confidence. So you can have 2 types of incontinence. The main ones are, that's stress incontinence. I'm leaking when I have increased intra-abdominal pressure, number 1. Number 2 is urgency. I feel like I need to go to the bathroom. Oh my God, I gotta go. And I'm doing the pee-pee dance to try and get there. And sometimes I just don't get my underwear down fast enough. That's urgent incontinence. That also needs to be treated because you start to live your life around the bathroom. When it comes to fecal incontinence, very, very sensitive topic. Very common, but very sensitive. Not as common as urinary incontinence, but this is when you cannot control your feces, right? You cannot control your stool. It is coming out when you don't want it to come. And this also coincides with what we call fecal urgency. When you get the urge to go, you don't feel like you ever have enough time to get there. Now, can you imagine how much anxiety and stress that causes any woman, right? Can you imagine how ashamed she is to speak about that? So that's why you definitively need to see your urogynecologist for this, because it needs to be fixed. These women become socially isolated and their lives become one large contraction because they're terrified and they're anxious about going in public because this happens. And we have many, many effective treatments for it, okay? And the last but not least is sexual function. Your vagina is used for sexual function. As we get older, there are many aspects that get affected by that, including overlapping with the first 3 symptoms, which are the incontinence and the prolapse. But if your sex life is being compromised, which is probably one of the earlier symptoms in perimenopause, then you should see your local urogynecologist to get treated for that.